4 here tonight, or should I say this afternoon, depending on where you're joining us from. We're so glad to have you. Thank you, Amaju. You are welcome. So tonight, 4 here tonight, or should I say this afternoon, Thank you. I guess that's streaming feedback coming back. Okay. Thank you so much. All right. Just a quick one before we introduce, the founder for Encapsulate Healthcare Professionals or Encapsulate Healthcare Solution Professionals is in my head, you see. So just before we do that, please do one thing for me. Share on your WhatsApp status the flyer for this program. Just invite somebody else. Remind somebody that needs to be here as well. And as we're doing that, I'm doing the same. And obviously, you need the link as well for registration. I'm not sure. Can they still register now?
No. You just send them the link. They can just join.
Okay. So
registration
you can just put in the link and people can just join directly. So let's do that quickly. And I'm doing the same. Okay. So tonight, you're all welcome to Heal the Wounds. Just a bit of a background about the founder for Encapsulate Healthcare Solutions. Flora is an award-winning senior pharmacist with over 21 years experience. She has several roles, which is at the world's leading psychiatric hospitals, where as a pharmacist, she has become an expert in clinical pharmacology. Flora has been an honorary clinical lecturer at King's College Institute of Pharmaceutical and Biomedical Sciences, London. One of Flora's passion is giving back to the community in two particular areas, education and health. And I guess that's the reason why we're here tonight, because she is giving back. She is the founder of Encapsulate Healthcare Solutions, an organization that seeks to improve the provision of wound management in Nigeria by training healthcare professionals for free. I think that deserves a heart. So maybe you want to use your reaction button or just say thank you in the chat. The program is called Heal the Wounds. The organization also seeks to educate Africans on different healthcare professionals topics to help them make informed decisions about their health. This program is called Own Your Health. She's also a volunteer leader for the education charity King's Gen Foundation, where she is the lead for the King's Gen Debating Academy. She is also the lead pharmacist for the Nigerian-based health charity Jinto Vince Foundation. The organization delivers health intervention projects in Nigeria. The most recent project was a week-long training for pharmacists and nurses on diabetic foot assessments in Lagos. I've been a partaker of this organization. I have been a student. I'm still a student of this organization. I've learned so much, in the midst of coming to Encapsulate Healthcare. So if you haven't registered, I really encourage you today to register and also to keep following. Also like, share, and subscribe all of our social media. Thank you so much. You're welcome. And have a very good day as you're here today. Back to you, Flora. Thank you.
Thank you so much, Bumi, and welcome everyone. Welcome to you all. Welcome. Thank you for joining this afternoon. We have a packed session for you today. I'm just trying to get myself off spotlight. I don't like it coming up. So let us know in the chat where you're joining us from. And we are just going to get straight to it. We are recording today. So if you don't want your beautiful face in the recording, then you can put your video off. But please make sure you are muted. We will take questions after each speaker. So our first speaker for today is Tope Shongonuga. She's an IT AI governance program lead by profession and a mindset coach, philanthropist, and social reformer by purpose. Her vision is to equip and empower people to harness and leverage the power of their mindset so that they can live as the best version of themselves, one intentional day at a time. She is currently delivering a mindset transformation program as a co-curricular activity called Mindset Makeover Club in Lagos State Secondary Schools. She also offers a group and individual coaching service. Tokwe, over to you. You're very welcome. Your first time at Heal the Wounds. Thank you for joining us.
Thank you so much, sis. Thanks for the intro. Good afternoon, everybody. And well, thank you for taking time out of your day, out of your life, even to come and learn, to grow, to rub minds together. So today I'm going to be just giving us tips, actually, because I'm going to leave to the professionals the hard skills aspect of this session. I'm coming in from the soft skills perspective. So as you can imagine, in order to be productive and to have a fulfilling career, I'm sure you would agree with me that you've got to have both the soft and the hard complementing each other. So that's why I'm here today. So I'm going to be sharing with us some tips on how we can cultivate a mindset of excellence, even within our professional orbit. So bear with me, just a couple of slides to go through, and then you can ask questions at the end. So here we go. Right. What is a mindset? I know the concept is defined differently. So I've got like 8 different suggestions there, and each one of them does encapsulate, we're here, encapsulate, of course, does encapsulate what it is. It means it's about how we set our minds ultimately. So I'm going to go clockwise. So what does it mean? It's how your mindset actually controls your way of thinking or acting. And you will be surprised that sometimes we demonstrate what could be deemed as a negative mindset in one sphere of our life and then a positive one in another sphere of our life. But essentially, at the core of it is how you set your mind under the different circumstances that we find ourselves in, or the interactions we have with one another. The second one there, the second definition or description even, is that our mindset drives our habit. It's our usual attitude to our career, our relationships, whether romantic or even friendship type, our attitude towards our body, how we look after our body or not, how we manage our finances or not. It's our state of mind. It exhibits our state of mind and our mental disposition at the time. So how you act, you can trace it back to how you set your mind under those circumstances. Number 4, our mindset is also can be defined as the collection of the dominant thoughts. Those thoughts that dominate our minds, whether you're when you're under pressure, for example, and you set your mind a particular way, you may find that you are reacting rather than responding, in a way that is calculated. So, there goes your mindset. Number 5, your mindset determines your perception. So if you have a negative view of something or someone, how you're going to respond to that person or to that situation is determined by how you have set your mind and your perception, right? And how you reason. So your reasoning also can be traced back or is determined by how you set your mind. Number 6, your mindset is actually the basis of your belief system, your ethos. What are your work ethics like? Do you work as though you're working for yourself and you're doing it diligently, or you work as though, oh, I don't care about the owner of this business, I'm just going to be reckless. I would do it better if it were my business. That's your mindset. And your model of the world. How do you view the world that you live in, or even the microcosm of the world in your daily living, daily life experiences, daily interactions with others? And last but one, your mindset is that set of opinions that you hold about something or someone. So if you're busy judging other people from your vantage position of strength, it's your mindset. Would you want to be judged from their vantage position of strength? Measuring your weaknesses against their strength. Again, it's how we set our mind. And the last one there is that our mindset is actually the sum total of who we are. So who your cultural background, your family background, your financial situation, your professional situation, your life's purpose, your vision, the collection of those factors culminate in how you set your mind more often than not. So now I'm going to jump in and go into and talk through a few tips here on how we can, in this profession, as healthcare professionals, of course, how we can cultivate that mindset of excellence. Because at the end of the day, what we all look at, and maybe some of us were reckless with it, time is our most expensive resource. And once it's gone, right? That's why it's the most expensive resource. You can never make time back, okay? So imagine that you're not being mindful of how you spend your time, even at work. Whether you're spending 2 hours at work as a healthcare professional, whether you're spending 20 hours on that day, that's 20 hours or 2 hours you'll never get back. That's your lifetime. That's part of your lifespan gone. So why would you not want to set your mind in a way that positions you to spend it excellently, so that you know that at the end of the day, you can look back and be proud of how you have spent your time, that you have not wasted it. So I'm going to go across. So I'm going to start from the left, top left, come down, and then do the right. Okay, so first tip, create a vision of excellence. What does that mean? You define for yourself what excellence means. And by the way, each one of us has greatness within us. So we know what excellence means. Nobody needs to be educated on what excellence means. Even though we can be lazy and accidentally we can act in suboptimal ways and be mediocre in the way we deliver in our areas of expertise, right? But at the end of the day, we know within ourselves what excellence means. So don't let someone define to you what excellence is. You know, you have greatness within you. Define for yourself what it means to you. And then I would expect that will be based on a set of standards, high standards, that you will put yourself through, that you will measure yourself against those standards first and foremost, before anybody else measures you, right? So set those standards, define the excellence, your version of excellence, right? And then strive to exceed that vision that you have of excellence. And as you do so, you'll find that you're inspiring other people, even though that wasn't what you set out to do. You just set out to do your best under the circumstances that you find yourself, making your day, your life ultimately worthwhile. Okay? So that's the first tip I'm sharing with you. Try to do it, and in so doing, you will inspire other people. The next point down from the left, embrace a patient-centered philosophy. So that's patient centricity. Okay, so you're going into this business, you're going there every day. You're turning up as your most authentic self. You're turning up as someone who has this high vision of excellence. You already have it in your mind. You know what the best is in your profession, rather. And you're aiming every day. You're working. You're striving to achieve that. And in doing that, you're patient, right? That's your client. That's your number one client. That's why you're there. So in order for you to operate from that place of patient centricity, the suggestion here is that your philosophy should be about looking out, doing everything from the perspective of the patient's needs. So try to understand their needs. Individuals, right? You might have 10 patients presenting with the same issues, medical issues. But I kid you not, I know you know this as healthcare professionals. I'm not one, but honestly, in day-to-day life, you can tell every one of us, we have a different frame of reference. Our backgrounds are different. The tapestry that makes us is different. So you can't expect that the same patients who may be presenting with the same symptoms, you can't expect that your treatment of them should be the same across the board. It should be like a one size fits all. No, it should be specific to that individual patient, that unique patient who has a unique background, maybe by their faith, they can't eat certain things, and because if they do, if they react to it or not, maybe their faith doesn't allow them, or their body composition doesn't allow them, their constitution rather doesn't allow them. So you have to tailor your care to the patient. That's what this is all about. So if you go in with that philosophy, you're gonna end up satisfying the client and yourself, knowing that you've done your best. Okay. And then the next one there is that you should be looking to improve your communication skills. So wherever we find ourselves in this world, on this side of heaven, definitely, We're going to come across people who have different language skills from us. And in Nigeria, for example, we have tens and tens, hundreds of languages, okay? So we may think we're in the same country, we're not really, we don't really speak the same language, or even people's language skills vary, right? So you should be looking to be able to hone your communication skills such that you'll be able to communicate effectively to your clients, to your patients. And also you need to be ready to make sure that that's a two-way communication. So you make sure you're conveying. So when they're trying to express themselves to you, even if you don't understand, you don't share their language, the same language as them, you should at least look for a way that you will make sure that they can convey. Maybe you call someone along to say, I don't really understand, or maybe explain it to me a little bit differently, or maybe speak a little bit slower. You're showing that you have good listening skills, but at the same time, you want to make sure that you're communicating. Communication is a two-way street, as I already alluded to. So it's not a matter of you just talking to them or they talking to you or at you even, but you want to make sure that you understand each other, because the only way you can truly serve their needs, meet their needs, is when you can actually convey to them and you hear from them as well. Okay. And then the next one there is that we want to build emotional intelligence. Absolutely. You need to be self-managing. So self-awareness is very important. You need to be aware of your own emotions. So if you know you're feeling, some people will say, oh, I just have a bad day. I woke up this morning and, it's a bad day. And then they go around offending with an offensive spirit. You don't want to take that to your clients. Deal with your own emotions. Be able to self-monitor, self-regulate, and self-manage in such a way that you're putting your patients first, your clients first, in a care environment, and you're managing your emotions while you're in that environment. Because if you're letting it spill over and they can see that you're distressed, you're not going to be able to, oh, sorry about that. You're not going to be able to add any value to the treatment you're going to give them. You might even get it wrong. Last one on that row, practice self-care, please. Self-care does not equate to self-centeredness. Okay, let's just ditch that mindset already. Self-care is your template for good, effective other care. You cannot care for other people effectively, efficiently, if you're neglecting yourself. So be ready to look after yourself. Make sure you know what triggers you, the stress inside you. Come up with I have what I call a well-being, an emotional mental well-being program where I travel every other month abroad. That's how I make sure that I'm keeping myself sane, my mind lucid, and I'm re-energized to carry on with life, because I want to live life intentionally, right? Taking us to the next point, nice segue. So the second row there, leverage the power of intentionality. When you wake up every day, I'd like to think that you want to make every hour that you are blessed with count. And in doing that, you want to make sure that you leave people better than you found them. So when you're going into work, when you're going into the patient room or whatever you call it, that when you're meeting, wherever you're meeting your patients anyway, whether in the community, in their homes, or in a central place, you want to go there with the intention of leaving them better than you found them. So you're looking at all of these things that I already mentioned. You're going to make sure that you're listening to them, you respect them, you're putting them at the center, at the core of everything you're going to be discussing, so that you can elicit from them everything they need. You can you will understand their personal circumstances so that you know how to tailor the care accordingly. You need to commit to a lifestyle of continuous and lifelong learning rather. You need to make sure that you're up to date in your profession, that, especially with the advancements that are coming through, like a fire hose, through a fire hose rather. You want to make sure that you're always on top of your game, that you're aware. It doesn't mean you're an expert. It just means you're you're a work in progress. You're always making sure that you understand. If you don't know something, I have a phrase of everyday school day. Learn everything. There's an opportunity to learn everything, something new every day. Okay. So if you live like that intentionally, you're a lifelong learner. You're picking up stuff. If you come across concepts or terms or terminology that is new to you, quickly Google it. Make Google your friend. Google your way to your destiny. And then you're learning, you're improving, and you're growing as you progress through your profession. And foster teamwork and collaboration. So as you can imagine, there are different areas or specializations in the healthcare industry. So you don't want to see yourself as the expert in your area. You want to collaborate with other people so that you can together weave that wholeness in the care of your patients. And you want to look to cooperate with people so that you pull together. It's a pooling of experience, a pooling of knowledge and skill sets. And that will bring you back to that place of patient centricity, where you're always looking for the best way to deliver care that is wholesome to your patients. And the last one point there is that we should always look to prioritize patient safety. Absolutely. Even when it's not like you've got the regulations in your face saying, oh, you must do this thing, there's a checklist. You should have a checklist in your mind. And that takes us back to that patient centricity, having that patient-centered philosophy. Always think about the safety of the patient. And remember that the patients, they're individuals. They have different needs at different times based on their background. And of course, the environment also contributes. So you want to look to ensure that you're creating an environment that is psychologically safe for your patients, as well as physically safe too. So you must prioritize that, because the last thing you want to do is to lose a patient, whether emotionally or physically or mentally, lose them to that recklessness or lack of care or carelessness even. And the last one there, we should be looking to uphold professionalism and ethics at all times. And it takes us back to that first point, which is that vision of excellence. You want to be able to satisfy yourself. You don't need an award for that. You want to be able to give yourself the award. You're upholding professionalism at all times. Integrity counts, respect for your patients, because then you will get that respect back, right? When you respect them, they will respect you enough to share with you. You're thinking about confidentiality here. When they share stuff with you, you make sure that you're holding their confidence, okay? And that when you give your word, you make sure that you follow it through. That's integrity. So that's their confidentiality. There's integrity there. You have to be cognizant of the cultural differences as well, because some patients will withhold information because of their background, that's how they roll. Okay, but you have to find a way of getting through to them while still maintaining the ethics of the profession. So that's what I've got to share with you there, and I'm going to take questions now. So any questions at any of the points? I am not looking at the chat. So sis, if there's anything in the chat box, let me know. So we got a few minutes, I think 5 minutes now, sis, to take questions.
Thank you, Takwe. Thank you. That was great. I like the quote. I think someone should tweet it. Someone should put it on their WhatsApp status or put it on IG. Google your way to your destiny. Someone put it in the chat already. Google your way to your destiny. Okay, we have one question. How do you handle stress when your workload is impossible to manage? And the person says, I try to practice self-care, but the workload makes it very difficult.
Okay. So that's a question that you're going to have to answer for yourself. I can give you an example of how I do, because at the end of the day, each one of us should know it's about the intentionality. Again, I'm going to use that word a lot, because when you're intentional about identifying those things, your stressors, those things that push you, that trigger, that stress, that put you in that place of stress, you will know what they are. Okay. So first you need to identify what your stressors are. Yeah. And then you need to determine for yourself, what is the thing that I do that tends to help me to get past that, to navigate that place, okay, so that I can come out of it, and then maybe park it. You might even need to park it sometimes. So, okay, I'll give you an example. It could be that in your own personal life, right, you're going through some difficult circumstances. Because we're human first, okay, first and foremost, we're human, so we're professionals, right? So you could either take that stress with you into work, okay? And then you find that you're not focusing, you're not concentrating, your mind is going back to that thing you left that wouldn't leave you, that you're carrying around. You've got to call someone at a particular time. That's where you're not going to focus. And anything that attempts to take your focus away from that thing that you're clinging onto, or rather that is clinging onto your mind, that thing is going to stress you, because it's going to be, you don't have time for that thing, but you're there. So you're there physically, you're not there mentally. You're not there emotionally. You're there physically. Your body is there, but your mind is not there. So you're going to feel stressed because that thing needs your attention. After all, you're at work. You're getting paid for this time. So you need to be able to separate that thing, because otherwise what you find is you bring that stress, that situation, it's on your mind, it's eating at you, it's clawing at you, you bring it to work, you can't focus. So now you're not even being productive in an environment where you're meant to be productive, where other people are depending on you to be productive, right? Then they add to that stress level. So they take it up a few notches, then you take it back home. So now your stress, which was maybe at 2 when you started, it's now 15. Okay. So you haven't been productive at work. You go back home, you are now even more stressed. So what do? You need to now start. This is where self-talk comes in. The power of self-talk. This is where you go, as in literally, but figuratively. You say, okay, so now I'm going to work, but I am not taking you with me. Okay. And we can do this. Try it. Our self-talk has so much power on us. It's what you give yourself permission to do or not do. So you can say, I am not taking you with me because I cannot deal with you in the next 8 hours anyway. So there's no point me allowing you to come with me to my workplace or my workspace and have you crowd things up for me and not allow me to come in to really show up. And then I'm going to end up bringing that back. So now I've got work, stress other people out. By the way, you're going to end up stressing other people out because they're going to need your attention. Your attention is not there physically or emotionally or mentally. You're going to think they're annoying you. You're annoying them. You didn't get anything done. Then now you're doubly, as I said, you've gone a few notches. So you need to literally park that thing. Don't take it with you. Don't allow it to go with you. And you can do this. And I can tell you this works for me. And sometimes I have to physically say it out that no, I have to say no, talk well, no. That's the power of our self-talk. So hopefully that answers your question, because if you don't deal with it, nobody else can. And honestly, if we don't deal with stress and then let it take over our mind and then it's like excess baggage now, it's only going to get worse. That's not going to help you anyway. So at the end of the day, you need to figure out what actually does help you. Hopefully that answers your question.
Thank you so much for that answer. Please, could you stop sharing?
Okay.
Thank you. Do we have any more questions or Tokwe? Anyway, if you think of another question, just pop it in the chat and we can take it later. So now we're going to move on to the... Okay, we have a comment, Tokwe. I think men manage stress more than women. How can we be like them by ignoring certain things?
Do you want me to attempt?
Yes, please.
A response? See, that's a mindset there. Honestly, who told you men you think they hide? You mean they hide things? We don't. We want to deal with stuff. They want to sit on stuff. They want to pile stuff under the carpet until it trips them up. We want to make sure there's nothing hiding under the carpet. So the answer to your question is, it's not like you're ignoring, you're dealing with stuff. You don't let stuff take over your life. You deal with it, because honestly, the stuff that we allow to pile up is stuff that we can deal with as they come in. Honestly, it's like your inbox, in tray. Some people, when you look at their email inbox, it's got thousands of messages. Not me. I can't stand it. If I'm not going to deal with it, it's like mail that comes in through the door. It's either going in the recycling bin or it's getting treated, dealt with, processed, because I don't want anything piling up and giving me stress. Okay. So it's a matter of, it's not that you're ignoring, you're dealing with them. You don't let them pile up. Men, they don't look after themselves. So that's a myth. It's a myth. Yeah.
Thank you for that. Thank you. All right. So if there are any other questions for Tokwe, we'll take them at the end. So we're going to move on to our next speaker now. And our next speaker is Professor Diane Ashiru Oredokwe, a credentialed consultant pharmacist who is lead pharmacist for the Antimicrobial Resistance and Healthcare Associated Infections at the National Public Health Institute. She's also Deputy Chief Scientist for the Royal Pharmaceutical Society, an honorary chair and professor of the Pharmaceutical Public Health at the University of Nottingham. She chairs the English Surveillance Program for Antimicrobial Utilization and Resistance and the National Planning Group for World Antimicrobial Resistance Awareness Week. She is an antimicrobial pharmacist by background And Professor Diane has led and significantly contributed to several projects that have shaped national and international policy in tackling antimicrobial resistance. Professor Diane, over to you.
Thank you very much. And thank you very much for inviting me to speak. Hopefully you can hear me okay.
Yes.
Excellent, thank you. Warm welcome to you all. If we can have in the chat, it'll be great for me to know who's in the room, and I'll go back and check that. Your professional background, just, nurses, pharmacists, doctors, community health workers, please put in the chat because it just helps me as I start to answer questions and as I go through my presentation. I'm going to take a more of an overview approach to my presentation today, talking to you around tackling antimicrobial resistance, sharing with you the global and national actions that are taking place, and then our roles as healthcare professionals. In my sharing today, I'm going to talk to you about the global action. From the national actions, I'm going to focus on the UK and also some aspects from Nigeria. But we also have another colleague, Yinka, who will be sharing with you, Dr. Yinka, will be sharing with you around some of the key activities that are going on within Nigeria and within one of the health institutes in Nigeria. So during my talk today, as I said, I'll talk about the global burden of AMR, some of the global and national actions, some stewardship tools. I'm hoping to be able to share video with you, and hopefully that will work. And then I invite you to become antibiotic guardians today. So in terms of antimicrobial resistance, when we talk about antimicrobial resistance, it's important that we need to think about it as 4 key aspects. We've got antibiotics, which is what most of us will be aware of or know of, and they're there to tackle or prevent and treat infections that are caused by bacteria. So examples of those are urinary tract infections, gonorrhea, cellulitis, tuberculosis. So we use antibiotics to treat those. We've got antifungals and antifungal resistance, and antifungals are used to treat or prevent infections caused by fungi. So examples of those are thrush or ringworm or athlete's foot. We've got antiparasitics, which are used to treat parasites or prevent infections from parasites. And for that, we have infections such as malaria, threadworm, or head lice. And then we have viruses, antivirals, which prevent infections caused by viruses. So that's for us is colds and flu, but chickenpox, shingles, COVID-19, HIV are all viruses. And so when we talk about antimicrobial resistance, what we mean is that these microorganisms, so either the bacteria, the virus, the fungi, or the parasites, have changed or mutated over time, and they don't respond in the same way to the medicines that we're able to treat them before or manage them before. So it's not the human beings that become resistant, it is the microorganisms, the microbes in the body that become resistant to these antimicrobials. Okay, so in terms of how does antimicrobial resistance develop, I think what this map shows here, and I don't try to read it in detail, it just shows the complication of what influences development of resistant infections. So all the microbes can naturally mutate and can change over time, and basically the resistance can occur naturally. However, we as individuals, human beings, animals, and the way we use antimicrobials, we increase the risk of this resistance happening at a faster rate. And so it's important that we tackle antimicrobial resistance both in human health, animal health, but also the environment. And when we do that all together, we keep these antimicrobials safe for the future. I think one way to think about the impact of resistance is imagine people that have a simple cut, and because of that cut, they die. And that's what happened before penicillin was developed, was that people were dying from simple infections. But since we have antimicrobials, things have changed. And so it's important that we keep these medicines safe for the future for ourselves and for the future of our children and generations. So I'm particularly passionate that we use antimicrobials appropriately, and I worry about the way antimicrobials are used. I worry about the fact that some people take antimicrobials every week just so they get pick-me-up, or they take antimicrobials for anything that is happening to them, headache, stomach pain. And sometimes the aim is not to stop people from taking antimicrobials, it's to make sure that it is taken appropriately so that we can protect these medicines. So we know that there is that we've called in the UK, we call it antimicrobial SOS, and that's because globally, more than 39 million deaths could occur from antimicrobial resistance by 2050. And I mentioned already that if we have ineffective antibiotics, the risk of disease spreading, illness, and disability is really high. And in 2021, antimicrobial resistance was directly responsible for more than 1.4 million deaths globally. And this is really important because that's what was directly attributable. So that's basically the cause of death was because they had infections that couldn't be treated. The ones that were associated with antimicrobial resistance was around 5 million. So that's where maybe somebody had cancer and then they happened to have infection on top of that and they couldn't treat the infection because it was resistant. So that those sort of things, there were 4.7 million of them globally, almost 5 million. The challenge we know is that the resistant infections actually impacts across all the world, both high and low and middle income countries. But what's really challenging is that the parts of the world where the challenge occurs the most, where the greatest burden is within sub-Saharan Africa, which Nigeria is part of, South Asia, Central and East Africa and Europe, and Central Asia, Latin America. You can see the order in which that is going. But the truth is that no one is safe because we know now since COVID that any infection can spread very, very quickly. So it's important that all of us take action to tackle antimicrobial resistance. So this map here just was published in the Lancet, and it just shows the mortality rates. The mortality rate is the death rates from resistant infections across the world. And you can see the parts of the world where it is red, orange, and those are the places where there's higher burden from resistant infections and the cause of death. Sadly, a lot of these are in young children, so really important that we take action. Some of you may be aware of the Sustainable Development Goals that the UN set. Antimicrobial resistance will impact it will impact the poorest. It will hit the poorest the hardest. So it's, that goal about no poverty is really important that we make sure that we can treat infections. It will impact on the zero hunger goal, because actually if we can't treat the animals as well, then we will not have sustainable food production. Also, clean water and effective sanitation is really important to prevent infections and reduces the rate of infections. And also, we know that AMR could also lead to 28 million people going into poverty. So in the UK, it's sometimes referred to as the silent pandemic, but for us, it is on our national risk register because we know that it costs us a lot of money, £95 million a year. The last time it was NHS when it was analysed. And we also know from our data that 1,800 people with with bloodstream infections had a resistant infection. So it is important that every country is tackling this. Within the UK, we are working on this as well. There's regional variation with it. And also for us, in the UK, those who are most deprived have a disproportionately higher risk of resistant infections than those who are less deprived. So basically, the poorer members of the society are having more infections and more resistant infections. And we're really now that we have the data, and data is really important to have this, and we're really working hard now to start tackling that in a more systematic way. Everybody has a role, and I think this is really important. Whatever role that you have in whatever your profession is, how you contribute, even if you're a member of the public, everybody has a role in tackling antimicrobial resistance. So nurses, in terms of how you, when you're giving patients their antibiotics, making sure that they get it at the right time is important. Making sure that they don't use antibiotics if they don't need it is important. Same for pharmacists. We should not be dispensing antibiotics for those who don't need them. They don't have a bacterial infection. Actually, if we give them antibiotics, we're purposefully harming those patients. So it's really important that we consider how we dispense or provide people with antimicrobials. Same with doctors. And then when we do give them antibiotics, we need to make sure that the patients have given appropriate information so that they can use the antibiotics appropriately. So globally, action has been taken. WHO had a global national action plan. And within that, there are 5 key areas and key objectives around improving awareness, strengthening the knowledge base around surveillance, that's making sure we have good data, and preventing infections in the first instance through sanitation, hygiene, and infection prevention measures. Then optimizing how we use the antimicrobial. So that's what we often call antimicrobial stewardship, making sure that people, both healthcare professionals and members of the public, know how to use the antimicrobials properly. And then making an economic case for sustainable investment. So that's really making sure that we can develop new antimicrobials. Because one of the key challenges with the AMI is that we continue to see resistance, but the pipeline for new antimicrobials is really low. And apart from that, even if a new antibiotic is developed and put onto the market today, even before it's put on the market or as soon as it's put on the market, resistant infections start to be found. So it's really important that we take action. This slide here shows us the 20-year vision for the UK, and these are our ambitions. I don't think you should worry about, I don't want to talk about this in the context of the UK. What I wanted to share there is that it gives you key ideas of what we need to do to tackle AMR. So it's for us being the importance of the global partner. So it's important that actually we're working across all nations together to tackle antimicrobial resistance. The importance of driving innovation, so making sure that there's good new ways of tackling the challenge we have, preventing infections and minimizing infections. I talked about the animal health, so really making sure that we think about this in the context of animals. So in the UK and across Europe, using antibiotics for growth promotion is banned. That's not the case in all countries, but actually what else can we do to make sure that those animals are still not prevented from having infections in other measures rather than using antimicrobials only? Importance of minimizing environmental spread. So really, people should not be putting antibiotics down the toilet so that it goes into the wastewater system, making sure that actually people are having good drinking water to have. These are some of the key things. And I'm talking about this in the context of both the UK and outside the UK. And then engaging members of the public and showing them the importance of using antimicrobials appropriately. We have, and then linked to the 20-year version, we have a 5-year action plans, and I'm not going to go to this in detail. It shows again where our key areas of actions are. And so this is our current national action plan for antimicrobial resistance, which is around preventing infections again, using antimicrobials properly, the workforce. So how do we educate the workforce around tackling AMR? I want to go now to Nigeria. So Nigeria Center for Disease Control and Prevention, NCDC, I guess now, and is focused around. So this is where a lot of the strategy and national actions to tackle antimicrobial resistance takes place. And this is from the website, from NCDC's website, and you can see there they have around 5 documents focused on antimicrobial resistance. There's a genomic surveillance is also within that, but they have guidelines for antimicrobial stewardship programs in health facilities, and then also situation analysis, and then the One Health National Action Plan. So for Nigeria, the National Action Plan states that they have 6 strategic objectives around governance, so making sure they've got strengthened leadership, collaboration, and coordination at national and subnational levels, awareness and education, so improving our AMR awareness and education across the health system, so both for healthcare workers, but also children and young people. Surveillance, so that's really making sure you have good data across human and animal health. Preventing infections, so making sure that there are good infection prevention programs in place. Biosecurity. Biosecurity is often used in animal health, so that's how do you keep the animals healthy. Vaccination uptake, that's really important. And then including access to wash, so that's water and sanitation and hygiene across One Health sectors. Stewardship is around how you use, making sure you have good quality antimicrobials, and then once they're available, making sure that they're used appropriately. And then research and development, so building knowledge capacity of stakeholders to improve the local innovations, research, development in antimicrobials, diagnostics, and vaccines. So really, again, you can see across the global, even what we have in the UK, what Nigeria has, the principles are pretty much the same in what we need to do to tackle antimicrobial resistance. And whilst this is written at a national level or a global level, these are the same things we need to be thinking about as individuals, as healthcare workers. Okay, so then going to our particular roles. So again, I've talked about stewardship. You could, contribute to or lead stewardship programs in your facilities, and you don't have to be a specialist to do this, or you can work with a specialist. You could ask, what is going on around infection management in my organization? What can I do to support? I understand that many of you focus on wound care. Within wound care, if the patient has resistant microorganisms in their wound, it's not going to heal. It's not going to heal. MRSA is an example of one, and we often have a good patient story about that. If a patient is then given an antibiotic or a medication, then can you make sure that they are reviewed regularly if they're in hospital, and that they stop taking it if they don't need it anymore based on the doctor's advice? Can we educate patients better? We can contribute to data. So national data is important, but we need people at every level to contribute to that data. Preventing infection, every single one of us contributes to infection prevention. We can wash our hands. That's one of the most impactful and important infection prevention measure that we have. Washing our hands is so critical. And then obviously vaccination is also important as well. Education and training, we can either you're here, so you're being educated, so that's great. When you finish, how are you going to share the information with other colleagues so that they can also be educated? And then also, development of new therapies. So if you're a pharmacist or wanting to do more research, then you may contribute to developing new therapies. Then public awareness and then policy action. So some of you on the call may be involved in policy within your organizations or elsewhere. I'm going to go now and play a short video. So just to check, Flora, please, how much longer do I have?
You've got enough time.
I've got enough time. Okay. I'm going to play a video. Before I go to play the video, I want to just show this here. So say, for example, a patient gets an antibiotic. So you're a pharmacist, you're a nurse, or you're a doctor, and you want to prescribe an antibiotic. You've decided that this is appropriate. They have bacterial infection, not virus, not malaria, not something else. They actually have something that is likely to be caused by bacteria. What do you then do? This is a tool we have available, and it's freely accessible. I can put the link there. It's important for the antibiotic to be for the right person. There's no point in somebody taking their mom's antibiotic or their auntie's antibiotic, or because that family member had that antibiotic and it worked for them and they seem to have the same symptoms. We should do that. It's really important that, because everyone's so different, and even if it's the same infection, we need to remember that some people may have kidney issues, they may have liver issues, which means that some antibiotics is not right for them or could harm them more, or they could be pregnant. So all of these things are really important. Also, they may be taking other medicines that could cause an interaction. And if they've had the same antibiotic in the last 3 months, they could be resistant. So say, for example, they had a urinary tract infection or kidney infection, and they've given an antibiotic and it's not worked within a week or 2 weeks. It's probably that antibiotic, they're resistant to it, or maybe that's the wrong diagnosis in the first instance. But if it's the right diagnosis and it doesn't work, it's probably because they've got resistance. So this is why also taking samples is really important, so that people can know what the susceptibility is. So what is the microorganism that they have in their system, which antibiotic will work best for it. So this tool here, we use it when patients go to the pharmacy to get medicines, because it's a way for the pharmacist to know what the antibiotic is for, so they can make sure it's appropriate for them. And also, some of the key things you need to think about is whether or not the patient's got kidney function challenges, liver challenges, if they're breastfeeding, if they're pregnant, or if they're over 65. And then there's also an opportunity to talk about vaccination, because actually vaccination prevents quite a bit of infection, and I think it's important that we promote that. And then also, if they are then taking the antibiotics, some of the things we need to tell them is whether or not they can take it with or without food, whether or not they know what side effects they may get. Tummy ache could sometimes happen. But if they get a rash with an antibiotic, particularly if it's penicillin, for example, then they're probably allergic and something needs to be done about that, or they need to be noted. It needs to be noted down. Whether or not they should avoid alcohol. So if they have taken metronidazole, which is, I think, flagyl is a common name in Nigeria, I may be wrong, then that, alcohol should not be taken with that, as an example. And then the fact that they shouldn't share the antibiotics with other people, or you keep them for later. And then for those, so thinking again as the prescriber or as the pharmacist, making sure you've checked the allergies or any risk factors. Check it against local guidance. So Nigeria does have guidelines on managing infections. So do you know what that is? Do you know what it is for your hospital? And then make sure you're using the right dose, because actually if you use a lower dose than they need or too high a dose, both can harm the patient. And also around the duration, how long should they take it for? Okay, I'm going to quickly play the video. So if you just give me a moment, I'll swap my swap around. And please tell me if you can hear this before I just share it and tell me if you can hear it.
In a hospital.
Yes.
Did you hear that? Okay, great.
Daniel presents to the clinic. Daniel has been feeling ill for the last few days.
Good morning, Daniel. What seems to be the problem today?
Oh, doctor, I feel terrible. Please help me.
Okay, Daniel, tell me more. In what way do you feel terrible?
I am hot and also shivery. My back hurts and it really stings when I go to the toilet.
What do you mean? Does it sting when you urinate?
Yes, doctor. And it looks cloudy.
Okay, Daniel, come through here so I can examine you.
After examination.
So, Daniel, your temperature is high. Your heart rate is also higher than it should be. I think you might have a urine infection or a UTI. It's really important that we treat this properly. I need to see if there are any signs of infection in your urine. Please, can you urinate in this pot?
Why?
We will send your urine off to the laboratory and the microbiology team will see if there are any bacteria or germs in it.
Okay. How long will that take?
That will take some time, Daniel. In the meantime, it's important that we act now to stop your infection getting any worse. Can you tell me, have you felt like this before?
A few weeks ago, it started to sting when I went to the toilet. My wife had some tablets left over from when she was ill last year, and she gave them to me to try. And they made me feel better.
Tablets? Do you know what they were?
Amoxi something. Doctor, I'm sorry, I can't remember. I took them for a couple of days and I felt much better.
Okay, Daniel, I'm glad you came here to see us today. It's so important that we find out what the problem is. Sharing tablets meant for someone else really isn't a good idea.
Sam has assessed Daniel and thinks he is showing signs of a serious urine infection. Daniel's previous antibiotic use puts him at increased risk of a resistant infection. When selecting the correct antibiotic to treat the infection, Sam should follow the principles of starting smart. It is important that Sam select an antibiotic which is likely to treat the bacteria that Daniel has. And as Daniel is showing signs of severe infection, it is important that Daniel gets an antibiotic quickly. Anita, the pharmacist, will clinically review and validate the prescription.
Hi, Anita. I need some advice, please.
Hi, Sam. Of course. How can I help?
I have a 50-year-old male patient who is showing signs of a severe UTI. What is the empiric treatment of choice?
Have you looked at our prescribing guidelines, Sam?
No, sorry. I always forget about that. I have sent a urine sample off to the lab, though.
Okay. Well, that's a good start. Is it worth getting a blood culture too?
Yes, I was thinking that.
Okay. So guidelines for severe UTI will be ciprofloxacin.
I don't think we have any on the ward. Is it okay if someone comes to collect from the pharmacy?
Of course. It's really important that we give the patient the first dose of antibiotics quickly. Please, can you send someone with a prescription and I will check if it's appropriate and process it as soon as possible.
It is important that Daniel gets an antibiotic quickly. Anita, the pharmacist, will clinically review and validate the prescription, making sure that it is appropriate for Daniel. When it comes to antimicrobial stewardship, we must ensure that we use the right drug for the right patient, at the right time, using the right dose, via the right route, for the right duration of time. 72 hours later.
Doctor, please, can you review the antibiotics for Daniel? He's feeling much better. He has no pain. His observations are all stable. And he really would like to go home soon.
Thank you, nurse. I haven't reviewed him yet today. I will just call the microbiology lab and check if his urine or blood samples grew anything. Well, Daniel, I'm glad you came to visit us this week. The blood and urine samples that we sent to the laboratory grew a bacteria called E. coli.
What is that, doctor?
E. coli is a nasty bug which can cause really serious infections if not treated with the right antibiotics. The E. coli the lab grew from your blood and urine was already resistant to some antibiotics.
What does that mean, doctor?
Well, Daniel, the good news is you are on the right antibiotic. You can switch to a tablet now. You are much better. You must complete the full course I prescribe you so we can be sure the infection is cured.
Thank you, doctor. Thank you.
If you experience any more symptoms like this, please come back to us immediately. You have grown a resistant bug which could become more difficult to treat in future. Daniel, and please don't take your wife's antibiotics again. Sharing antibiotics can increase the risk of resistance developing.
Please take the antibiotics as described on the label and do not save them for future use or share them with others.
Thank you. So that video there hopefully shows you the multidisciplinary approach that we need to tackling antimicrobial resistance. We call that video the continuum of care, and it was developed as part of a program that I was working with, and actually Dr. Yinka is also part of, on called Commonwealth Partnerships for Antimicrobial Utilization and Resistance. And interestingly, I've just realized what we did was had different accents, and I've just realized that our patient would not be as we would expect it to be for the demographics we were focusing on. But it was a really good video, and I really I learned a lot again. It was just great to watch that again, and hopefully you can see the role of the patient, the role of the doctor, the role of the lab staff in terms of making sure that they provide the right susceptibility results, the role of the nurse, community pharmacy. Everyone has a role in tackling antimicrobial resistance, and that just shows an example of a continuum of care there. I'll put this link into the chat. It has a whole range of resources that you can use, including more prescribing app for some of the countries that have them, CPD platform if you're a pharmacist, and part of the Nigerian Pharmacy Society. You'll be able to access some of these additional resources on the CPD platform. And the explainer videos that I just showed, there are more videos on there as well that you can use. So I'm just going up to my final couple of slides now, and I just wanted to invite you all to become antibiotic guardians. And what this does is really gives you an opportunity. There's so many different things that we can all do. But what this does is it gives you an opportunity to choose one action that you want, actually two actions that you want to take forward. And that's taking it forward as yourself as a citizen, because all of us, even if we're doctors, pharmacists, nurses, we're patients, or we're members of the public in the first instance, at some point in our life, we will have an infection at some point. And so, you know, as a patient or as a member of the public, what do we want to commit to? And then as a healthcare professional. So I'm going to encourage you now, if on your phones, to just go into www.antibioticguardian.com/Africa. I don't know if Flora, a colleague, can help just put that into the chat. So it's antibioticguardian.com/Africa. We've got the general one, but the Africa page was a collaboration with Africa CDC, Nigeria CDC as well, and the African Union. That's how we developed that page together. And when you get onto the page, you will see that you can choose if you're a human health or animal health professional, if you're a citizen or farmer, if you're a student. And then first of all, you choose as a citizen what you want to pledge to. So, you know, that you'll use antibiotics only when indicated, or if you're prescribed an antibiotic, you'll take them exactly as prescribed, never share them with others, as an example. Ooh, it says that my screen has paused. That shouldn't be the case. Let's just resume. Can you see my screen now?
Yes,
Okay.
it's moving.
I'll just put that back on screen share. So all the Zoom controls are covering a few things for me. So then, and then you choose, you know, as a whatever role you're in, if you're a human health professional, doctor, dentist, nurse, there's one particular group of pledges, and then if you're a pharmacist, I think there's a different group of pledges for pharmacists, pharmacy teams, mainly because we have additional responsibilities. Or if you're a non-prescriber community health worker, then you can choose the other one around healthcare and public health workers who are non-prescribers. And if you're a member of the public, you can do the same as well. So really encourage you to go to antibioticguardian.com/Africa. The great thing about this is that I took that screenshot of 1,700 just as I was about to start this presentation. So I will be able to tell how many people on this call have chosen a pledge when I next go to the website. And that's the end of my presentation. I'm happy to take questions, and hopefully that's been of some value to colleagues on the call today.
Thank you so much, Professor Diane. That was great. Do we have any questions? You can raise your virtual hand if you want to ask a question, and I'll ask you to unmute, or you can pop your question in the chat. So we'll just take a couple of questions before we go to the next speaker. Dr. Yinka, please stop sharing for a minute. Let's just take the questions first. Thank you. All right. Do we have any questions? Okay. Bisola, unmute yourself, please. Go ahead, Bisola.
Hi. So Diane, in terms of, great work, of course, that you've done and you've been doing. And I guess it's in Nigerian setting, especially in terms of professional input for antimicrobial resistance reduction. Unfortunately, antibiotics are widely available outside the health care setting. So is anyone and everyone a free for all? And I appreciate that you cannot eradicate that practice completely. But what are the kind of work that is being done on the ground in Nigeria to make sure that those kind of outlets are either being not shut down, but are being prevented from having access to those kind of medication, if you're aware, that is?
That's a tough question for me, and I wouldn't be doing colleagues in Nigeria justice by trying to answer that question. What I would do is I will say what I know so far, and I will invite others on the call because there might be others who know more than me, Dr. Inka, for example, who can share more. From what I do know is that the National Action Plan for Nigeria tackles a whole range of actions that are needed, and that includes access to medicines. And it's about access to quality medicines. And you're also aware there's NAFDAC, and they've got the regulatory systems in place. And antibiotics it is not legal to get antimicrobials without a healthcare professional. That's the key. So whenever it's done outside of that, there is that challenge. I do think, though, that in certain countries, there is a balance to be had in terms of how people access antimicrobials, because we know that they do not have access to healthcare professionals. So in many parts, in high-income countries, the challenge is access. The antimicrobials are there. But in some parts of the world, they can't access healthcare professionals. So we do have to have a way in which we balance how people can access medicines. What I do want to say is that where they are, the illegal sources, and I guess you're talking about the market sellers, that's too challenging because they're not healthcare workers and they're not healthcare providers. So colleagues on the call may know better what is happening, if they're being shut down or not. I don't. I know, but it's not for me to say, I'm afraid. But I know the Pharmaceutical Council of Nigeria is also doing quite a bit of work around how to educate the pharmacy teams. So I don't know if any colleagues have a response to that.
Thanks, Diane. Bisola, hold on to that question. We'll take it after Dr. Yinka. She may cover some of it in her talk.
Can I ask another question, please?
Yes, of course. Yeah? Go ahead.
So this is UK related in terms of Pharmacy First, and the one of the services provision allows you to provide antibiotics where required accordingly, and therefore with your data, have you noticed an increase in antibiotics use in the UK, possibly due to the service provision, due to increased access, which is meant to be a positive thing? But have you noticed an increase? I don't know what kind of things you measure in terms of the agency, but
we're looking at the data, both from within the UK Health Security Agency NHS England is also looking at the data, but I'm also part of the team evaluating the whole so NIHR, the National Institute for Health and Research, commissioned research groups to evaluate. So that's University of Nottingham, London School of Hygiene and Tropical Medicine, ourselves, and a few other research groups. So that analysis is ongoing. I think what is looking like in general for most of the indications is that it's balanced, basically, if you look at it across the years. So what it appears is that there's a move from GP practice into community pharmacy, which is what was being done, was to increase access. There is one indication where there's a slight increase, and we're just working out how true that increase is or not. But overall, we're not seeing a massive increase across all the infections in the use of antibiotics at the moment. Obviously, it's still only.
Okay. One last question. I know I'm really being greedy.
That's okay.
To do with antibiotic guardian, and in terms of how the pledge is made, hand on heart, I did mine, and I can't remember what I did say as my 2 pledges. And I do wonder if there's an opportunity, or maybe it's already in place, to ensure a yearly reminder, to say, this was what you pledged. How is that going? Evaluate, personal evaluation of some sort, baseline versus progress versus where did you end up, or do you want to change all that because your work sector is changed, and therefore, do you know what I mean?
Yeah, no, that's really good feedback. Thank you. And one of the things that we've had from our evaluation is that need to start to engage more with the antibiotic guardians. We started a newsletter this year, so please let me know if you got one around October, September. If you didn't get it, either we don't have your email address or it's gone into junk, or please do re-pledge again. If you pledged on the Africa pledge, actually, we're not communicating with that. We're only communicating with UK colleagues at the moment. It's a very good point about us reminding people what they pledged, and I'll talk to the web team about what we can do around that.
Okay, that's me done. Fab. Thank you.
Thank you so much.
Thank you, Bisola. That's great. Any more questions for Professor Diane? If you think of any, you can post them in the chat, and then we'll take it all at the end. Thank you so much, Professor Diane. That was great. So we'll go to the third speaker for today. And our third speaker is Dr. Olayinka Adeyemi. Yep, she's on. So Dr. Olayinka Adeyemi serves as the Deputy Director of Pharmaceutical Services and an antimicrobial stewardship pharmacist at the University College Hospital, Ibadan. She's renowned for her passion for promoting rational antibiotic use. She has championed numerous campaigns within and outside the hospital to advance antimicrobial stewardship. She is a recipient of the prestigious African Leadership Fellowship for Antimicrobial Stewardship Award. Dr. Adeyemi has made significant contributions to antimicrobial stewardship. She has also facilitated workshops for community pharmacists, emphasizing their vital role in combating antimicrobial resistance. Dr. Adeyemi, over to you. Your video is off. I can't find you. Let me just find her. Okay. If you cannot go ahead and unmute, you should be able to unmute. Yeah.
Hello, everyone. It's my pleasure to be here today. Can you all hear me?
Yes.
Can you hear me? Am I audible?
Yes, we can hear you.
Okay, thank you very much. Thank you, Professor Diane. And you've done a lot of justice to what I wanted to talk about today. And I will basically just speak about a few things. My slides have gone off. I don't know what has happened.
Okay, just stop sharing and then reshare.
Just a minute.
That might help.
Okay, I stopped. Did I stop sharing?
Yeah, stop and then do it again.
Okay.
Then hopefully it should reset.
Okay. Am I still on?
Yes, you are. So while Dr. Adeyemi is doing sharing her slides, please post any questions you may have while she's presenting or for the previous speakers, and we'll take all the questions at the end. Yes, we can see you. Just need your slides to cooperate. All right, here we go.
Okay. Good afternoon, everyone. It's my pleasure to be here today, and I'll be speaking on tackling antimicrobial resistance. The journey so far, Diane has done a lot of justice to most of the things I'll be talking about. I will just go to what we are doing in Nigeria, and basically from what we are doing in the University College Hospital where I work. I know many Nigerians who are on this call are wondering, and from the question that we had earlier, I know that a lot of people think that, oh, how are we going to do this? I remember the first time I was called to into the Antimicrobial Stewardship Committee. That was my first question. I thought it's like a pin in a haystack. Where do we start from? And but we'll always take one step at a time. And I just want to share with you some of our success stories in the University College Hospital. I don't know why my slide is not moving.
Yeah, Diane is sharing for you, so she'll move the slides for you, okay?
Okay. All right. So I want to welcome you and I thank you for joining us today to discuss the critical issue of antimicrobial resistance. As the AMS pharmacist at the University College Hospital and an African Leadership Fellow, I would like to share with you our journey in tackling antimicrobial resistance so far. From my story, I hope to inspire all of us to join the fight against antimicrobial resistance, which has become a global health threat. And I want to say, just like Diane said, no matter what your profession is or your qualification, you can all join this campaign train for responsible antibiotic use. Next slide, please. While I quickly talk about, while the next slide is going on, I just want to really give a brief introduction about myself. I became a member of the Antimicrobial Stewardship Committee, not as a specialist. I was a regular pharmacist doing my job. Many years ago, I went for an internship training in the UK, 6 weeks, and that was where my passion for antimicrobial stewardship was ignited. It wasn't a very comfortable situation. It wasn't an ideal situation, but I jumped into it. The first speaker talked about excellence in your workplace. I was so passionate about it, and as a result, I was drafted into the Antimicrobial Stewardship Committee. And I began to do little bits here and there, campaigns here, clinical rounds. I was always called upon to speak to doctors, to speak to people. And that was where it started, really. So no matter what your qualification is, you may not be a specialist, you may not be an ID pharmacist, but whatever your qualification is, you can be an antibiotic guardian. I want to start with this quote: antibiotics are unique as drugs that lose their efficacy over time for all patients the more they are used. So don't think that it's just going to affect the person using it. It's going to affect everyone, because if you have a resistant bacteria, you can pass it on to somebody else. So it affects every single one of us. Next slide, please. Okay, so I think Diane has spoken about this. So let's go to the next slide. I don't want to speak on this. Next slide. Okay, so let me quickly talk about this, because the one before that, I want to talk about the drivers of antimicrobial resistance. That's the one before this slide. And this is very important for us in Nigeria. If you look at the x-axis of this slide, you will see that the human antimicrobial misuse or overuse and animal antimicrobial misuse or overuse are the main drivers. They have very, very high tendency to cause antimicrobial resistance. And it's interesting that animals seem to use more antibiotics than humans. And of course, we know that in Nigeria, almost everybody has a farm, almost everybody has a poultry, almost everybody is taking care of goats and all of that, and they give them antibiotics. Actually, when you go to the poultry to buy chicks, they give you antibiotics alongside. Those are the things that are mainly causing antimicrobial resistance. So that is why we need to talk about it. Is there a way we can reduce human misuse of antibiotics? Is there a way we can reduce animal misuse of antibiotics? Next slide, please. So let me just share with us some of the success stories. We are not there yet, but we have started something. The journey of 1,000 miles always begins with a step. don't look at it like, oh, we haven't done anything. Nigeria is far away from, achieving antimicrobial stewardship. We are not so far away. We have started something. So these are the 6 things that we have started to do. Number 1, strengthen AMS programs. Education and capacity building. I've been involved in a lot of that. We do that a lot right now because it's important that people are aware of what is going on. Community engagement and collaboration, policy advocacy and funding, promoting rational antimicrobial use, and enhanced diagnostic capabilities. Next slide, please. Okay, so I will start with the first one. What are we doing in UCH to strengthen AMS programs? The first thing is that we created an antimicrobial stewardship team and committee. And this is multidisciplinary. We have pharmacists, physicians, microbiologists. And I tell you, in all my years of practice, I've had so much engagement with people of various disciplines. There's no time for professional rivalry now because everybody has a role to play. And so all of us, we have regular meetings, and it's been such a wonderful time. For me, it's been very productive, and it has really helped my my job satisfaction. All of us, various members of this team, we strengthen the antimicrobial stewardship programs. Then, of course, there are standard local guidelines. For those of us who are in Nigeria, we know that there are guidelines, but many of them are not being followed. But right now in the hospital, because all the various clinical units are represented in this committee, every clinical team is supposed to send a representative. So everyone is now mandated to develop their own local guidelines for various specialist units. We have started on that. Some people have submitted already, and we're working with our UK team to be able to put all this together so that at the end of the day, we'll be able to work with guidelines based on the institution's antibiogram. Then another thing that we are also involved in is surveillance and audits. Before now, we've not really had, I can't say that we have any data to say this is how antibiotics are being used. But in the last 1 year, we have conducted global point prevalence survey, which is a kind of snapshot that gives you an idea of how antibiotics are being prescribed in the hospital. From this GPPS, you can also know some basic indicators, like do doctors write start and stop dates and things like that. And from the 2 that we have conducted so far, the data that we get from it, we're going to use it to speak to doctors to show them, there's nothing like evidence-based discussions. We should show them this is what you are writing, this is what's going on, then it's going to help. So this is like going to be a kind of good feedback for all our prescribers in the hospital. Next slide, please. So this is just pictorial representation of our Zoom meetings. We Zoom it on Zoom. We meet physically, the members of the antimicrobial stewardship team. Next slide. Just a lot of pictures, just to show you that we are actually doing this thing. It's not just putting words together. Next slide. Well, that's also us as well, developing the facility-specific action plan. That is the GPPS that we conducted in December 2023. I just gave a snapshot of how antibiotics are being used in UCH. And that was comparing what we did in 2017 to what we are doing presently. Next slide, please. Okay, second one is education and capacity building. I'm privileged to have been a recipient of the Alpha Award, and that has enabled me to develop professionally. Diane mentioned something about the CPA-CPD platform, which has really helped. I have almost all their certificates, and I've really gained a lot of insight on antimicrobial resistance and antimicrobial stewardship. I've shared this also with many of my colleagues in the hospital, and many of them have also gone through this course as well. So there's a kind of step-down training to build capacity in the amongst pharmacists. Also, education and training. I've been so involved in this. We visited almost all the clinical units in the hospital, healthcare providers, on the principles of AMS and emerging trends. And it's so interesting that some things that you think that people know, they really do not know. And so we go to the basics. Myself and we have members of the Antimicrobial Stewardship Committee. We have a doctor that we work together, and we go there. He talks his own bit. The microbiologist talks about his own bit. I talk about my own bit as a pharmacist, and it's always so enriching. Then public awareness campaigns as well. We increase awareness among patients and the public about the dangers of antimicrobial resistance. Presently, in this particular year that we just concluded, the WOW week, we developed some handbills and some posters where we put some critical information about antimicrobial resistance. There's a lot of information around the pharmacy right now to help people know a lot more about antimicrobial resistance. Also, we've been involved through campaigns in the wards and clinics. I remember, was it last year or 2 years ago? I was there with some medical students and we went to the wards. We divided ourselves into groups, talked to patients one-on-one about the dangers of antimicrobial resistance so that they can carry this message home and talk to other people. We'll also be on radio and TV programs as well. Next slide, please. Okay, so this is just to let you know that the Alpha program, these are the things that I've been able to enjoy as a member of, as a recipient of the Alpha Award. Basically, capacity building and leadership development. I've gained so much from this program that things I never would have thought I could do, I'm now able to do because from this program, capacity has been built into me. I've been able to help other people. I've been able to mentor other people. I've been able to collaborate with other members of the healthcare team, and it's been such a fantastic program. Next slide, please. So the next slides just pictures of some of the things that we have done so far. Those are the, I have so many certificates from CPA, and anybody can do all of these programs. If you are a member of the Pharmaceutical Society of Nigeria, the course is free. So I just want to encourage every pharmacist, even if you are not a pharmacist, you can take some of these courses and they would really, really build capacity. Next slide, please. Okay, so those are the places that we have visited. We've been to all these clinical units, speaking to them about antimicrobial resistance, rational prescribing. I speak to them about my own point of view as a pharmacist. We are the ones that see the prescriptions. We are at the back end. And so we are able to let them know, these are the prescriptions we are seeing. This is the way you write prescriptions, and we're able to correct them. So we visited all these places. We've actually even visited the boardrooms, spoken to the CMD. I can't count the number of times we've been to see the CMD in the past year. So many times we've been there. Next slide, please. Okay, so those are just some of the places that we visited, the flyers that we sent beforehand, and the few places that we visited, just to give you a pictorial representation of what has happened so far. Next slide, please. Okay, so last year we went out. We went to a local place, a public place that was very, very busy. And so we discussed with many people. I also went to some places within the hospital, giving health talks. And it was so interesting because people were asking questions. They were really interested because when we let them know the burden of AMR, everybody got interested. I was so impressed at the kind of intelligent questions that people that we consider as leeches, that they were asking us some of these questions because we spoke to them in our local dialect as well, and they were able to understand the importance of taking antibiotics properly. Next slide, please. Next slide is it hanging? Okay, so those are some of the IEC materials that we distributed. One of them was also translated in our local dialects. And then we have a lot of pictorial representation so that people would understand that antimicrobial resistance is not just about the human, but it also speaks to the animal. So education and training is so important. Public awareness is critical because we can be talking about it in the hospital, the healthcare professionals know about it, but how about the public out there? They are the ones that go to the market to buy tetracyclines. They are the ones that go to the market to buy what we call akapo in Nigeria. All those, we have Flagyl inside it, amoxicillin. So if you begin to train and educate the people who are in the grassroots level, then we are able to reach more people than ever before. So we have all these flyers that we also interpreted in our local dialects. Next slide, please. Okay, so we also developed an antibiotic counseling checklist. Dan also mentioned something about that, but this is new. It's something that all pharmacists are supposed to start using. It's something very new. It was just during the WOW week that we developed this. So it helped the pharmacists to make sure that it covers all the various aspects of counseling, especially with respect to antibiotics. Something interesting happened some months ago, a patient came to the pharmacy, one of our outpatient pharmacies, and she complained that the pharmacist sold a drug, which was an antibiotic, amoxiclav. Many of us are familiar with amoxiclav. And that it had expired. And we said, how do you know it had expired? So she told us that when she took the medication home, it was supposed to be for her grandmother. So she redispersed the amoxiclav in a pill box. Now we all know amoxiclav is photosensitive and also moisture sensitive. So by redispensing in a pill box, the amoxiclav had absorbed moisture and it had changed color. So the thing had become bigger. The tablet had, absorbed moisture. And I felt that was the problem of the pharmacist, because the pharmacist did not educate the patient properly on how to store these medications. So those are the kind of things that it's so important. We always let the pharmacist know that you are the last point of call. What you say to the patient is what they will go home with. And if by adventure they forget, did you say something? Did you give them something to go home with? And so that is what we're working on right now, because we believe that if we're able to speak to patients properly, then people sharing antibiotics will not happen. People throwing antibiotics in the toilet will not happen. We educate everyone that comes across our way, and that's what we're doing presently. Now, that's us in the, we went to the TV station last year for the Wow Week. Next slide, please. I'll be rounding up shortly, just a few more slides. Community engagement. We had a workshop with community pharmacists. We cannot sit in the hospital. We all know that a high percentage of antibiotics are being purchased in the community from community pharmacists. So we collaborated with the Association of Community Pharmacists in Nigeria, and we had a one-day workshop, and it was so interesting. The national chairman of ACPN was there. NAFDAC was represented. All the top level, agency in the country, most of them were there. And we came up with one of the things that the ACPN chairman said was that they were going to develop antimicrobial stewardship modules to be included in the MCDP, which is MCPD, which is very important, because now pharmacists, community pharmacists all over the nation will be trained on antimicrobial stewardship. And I think this is a very, very good development. Next slide. That's us at the workshop. Those are the objectives that we have for the workshop, and we've been able to achieve some of those objectives. Next slide, please. Policy advocacy and funding. We are involved in advocacy and funding. Basically, right now, there's an existing funding from the Fleming Fund, of which I'm a recipient. That's why I'm an Alpha Fellow. And some of the things that we enjoy enables us to scale up antimicrobial stewardship and IPC programs. Next slide, please. That's our partnership. Just go to the next slide. We have a partnership with the Sheffield Teaching Hospital. Then another one is promoting rational antimicrobial use. One of the things that is in progress right now is a restricted antibiotic formulary to control access to broad spectrum and high risk antimicrobials. We have an exceptional management support, and they have enabled the process. And right now we are working on preparing a document that would restrict some particular antibiotics. Actually, we had done it in the past, but it failed because most of the prescribers, once the pharmacist says no to a prescription, then they will send them out. But now there's going to be a policy, there's going to be a restriction on some of these broad spectrum antibiotics. So that's policy advocacy in the boardroom, and that's a picture with us with top usage management staff. Next slide, please. Okay, so that talks about our lab. We have an upgraded microbiology lab. It's a national AMR reference lab, and that ensures timely results that will help for clinical decision making. Of course, we have challenges here too, because we have those equipments, but the consumables, many times we usually have stock out with some of those things. Let's go to the next slide, please. So these are some of the challenges that we experience. Limited resources. Now, for you to engage in public awareness programs, you cannot do that without funding. How do you go to the marketplaces without funding? How do you go to the television without funding? There's a lot of limited resources, but I'm somebody who believes that I will not allow challenges to stop me. The challenge is just there. Whatever challenge that I face is just there to make me a stronger person. So I've learned to look for ways to go through the challenges to be able to get to where I'm going. So in spite of the limited resources, we are still able to achieve a few of our objectives. We have inadequate infrastructure. I remember when we went to the wards to carry out the GPPS, going through case notes, paper-based case notes. We don't have electronic medical records. It was so difficult looking at all those case notes. We spent so much time. You will spend sometimes 30 minutes on one person, on one case note. So it was very, very difficult. They are challenging, but we were able to get what we needed from there. Stockouts from the hospital, antibiotics, lab consumables. We have those equipment, but we're not able to carry out those tests as necessary because the consumables are not available. The cost of healthcare. When patients get prescriptions, they need to pay out of pocket, many of them, and they don't have the money for it. So that's what causes many of them going to buy something lower or getting something that looks like what they need. And that's why they will go to neighbor to share their medications. So that's a major challenge. Lack of data. When we started, we didn't really have any baseline data to start with. But I believe that at least we have an opportunity now. Let's start now. Let's begin to gather data. There's very, very little time for clinical care. A lot of people
Okay. Looks like the network has
are
decided.
engaged in work that they're not even supposed to have left the country. And so we have very few people doing the work of
Okay. Dr. Adeyemi's network has decided to play up. So while she's trying to get back, are there any questions? If there are any questions for any of the speakers, so all of them are going to come back up now. Diane, please, if you could stop sharing, and then all the speakers will come back up. If you have any questions or comments or contributions, just raise your virtual hand, and then we can take your question, comments. Let me just find. So hopefully Dr. Adeyemi will be able to reconnect. All right. So any questions or comments, please just raise your virtual hand. I will ask you to unmute. And let me just check in the chat which ones we've got already. Okay, I saw one about negative. Okay, so there's a question. Why do antibiotics impact on the good and the bad bacteria? I assume that question is saying. So go for it.
Can you repeat that? Why
do antibiotics impact on the good and bad bacteria?
I don't think it cannot discriminate. It's there to find bacteria. So it finds any bacteria, except it is resistant. So that's the challenge. So yeah, that impacts on the good microorganisms that we need on the system, in our bodies. We need some of those good microorganisms in our stomach. We need them on our skin. But with the antimicrobials, the way they're designed is that they're there to impact on any microorganisms. And that's why it's important that we keep a balance of not using antimicrobials when we don't need them, because what you're doing is killing off all the good bacteria in your system when you use them unnecessarily, because they can't find the harmful bacteria to focus on.
Yes, great. All right. Next question. Is there a protocol for measuring or assessing AMR burden?
Yes, there is a protocol. I guess it depends on what level colleagues are asking. At a local level, then you'll be using your antibiogram. So looking at your from the lab, what is coming out of the lab. At a national level, they collate it as well from the lab upwards. And then there are some modeling that is done. So the Lancet paper has measured a global AMR burden. I can put that into the chat. So there are systems in which they are done.
Okay. All right. Bisola, are you still online? If you are, just raise your hand and then just ask your question again. We'll open the floor for colleagues in Nigeria who may be able to answer it. It was your second question, I believe, or your first one earlier on. So if you're still online, just do that and I'll ask you to unmute. While we're waiting
I
for
think her
that.
question, I can repeat what her question was. Her question was, what is being done to tackle illegal sources of antimicrobial purchases? So, for example, through medicine sellers.
All right. Is there anyone online who wants to answer that?
Okay, let me make an attempt.
Okay.
Actually, I know that sometime last month there was a meeting, a top level meeting where they had they were to have not just antimicrobial policy, prescription policies, which is something that will now be given out to the populace. People will not just be writing prescriptions indiscriminately anymore. But the challenge that we have in Nigeria is that a lot of these policies are there with Ministry of Health, is to step it down to the people who really need it. Because yesterday I was at a meeting and I found out that there's a lot of protocol with the Ministry of Health. There are a lot of strategies that they have, but to bring it down to the people who are going to use it is where the problem really is. But there's a lot of work going on, right? Like I said, I was at a meeting yesterday. They are developing protocols for antimicrobial surveillance, developing protocol for antimicrobial use, consumption, measuring how antimicrobials are being used. So a lot of work is being done by the NCDC and the Ministry of Health presently. But as far as the open market is concerned, everybody knows that it is illegal. But to enforce this law is where the problem is. But there is a law. It is an illegal transaction, but it still goes on openly. So I'm not sure I can answer that. If something is going on, but something has already been done. It is just a problem of enforcing these laws and putting them in place.
And I can add to that, I guess the challenge, as I said, is that balance. Or, well, I guess, it's how do people access? What India has done is that they went with the approach of the broad spectrum antibiotics. They have a red line on the box. So from the manufacturer, it is got the red line. So then they've done a lot of public education to the members of the public to show that if you're buying that outside of a healthcare system, you're likely to harm yourself. So they didn't do it for all antibiotics. They've done it for the broad spectrum one as a way to start to, because I think it's also the members of the public, because if the members of the public don't go and buy from these sellers, they will stop selling them as well.
Yes, exactly.
So it's a two-way approach. Yeah, it's challenging.
Yeah. Thank you for that. Okay, Kehinde, could you raise your virtual hand and ask your question? How can we access those training opportunities in AMR? Where are you based? If you can't speak, then just let us know in the chat. So the question from Kehinde is, how can we access those training opportunities on AMR?
The CPD, sorry, Dr. Inka, you're on mute. So the CPD one is available through CPA. I can try and put the link in the chat. And I'll also put the other tools one as well. But there's also open resources on MOOC. So I'll put some resources in the chat, but Dr. Inka might want to share some more.
Yeah, that's exactly what I wanted to say. The CPA CPD is a fantastic platform that you can go to. And from there, you'll see a lot of other resources. It's just a matter of interest. If you're really interested, there's even one with the Fleming Fund right now. Maybe I'll send it to Flora because my laptop has gone off right now. I can share that with Flora. That's a very, very interesting one. It's an open course for everybody. It's very extensive.
Yeah, as well.
You can actually join that one as well. So I'll share that with Flora as soon as this meeting is over.
All right, and if you would like that resource that Dr. Yinka is going to share with me, please, you need to pop your email in the chat because I may not have your email to be able to forward it to you. So it's important that you pop your email in the chat, then we can get that resource to you. Okay, yes. So thank you, Diane, for popping those. Any more questions? Lots of great comments. Well done to everyone. Speakers.
I have a question.
Yes.
I have a question for the members on the call.
Okay.
What have they done to tackle antimicrobial? What actions have they, how has this resonated with them? What are they doing around antibiotics, or how do they feel things are going on the ground for them?
All right, who wants to take it that? Just raise your hand and then I can unmute you. If you want to contribute, if you want to answer that. No takers?
So
All right.
Gani has put their hand up.
All right, just unmute, please. Thank you.
Good afternoon, everyone.
Good afternoon.
It's a pleasure to be with you again. Talking about antibiotics this time. I had somebody saying that once you are prescribed with antibiotics, you should endeavor to complete the dosage. In other words, to be sure that what you are being treated for is completely cleared.
Mm-hmm.
But there's one question, where you can take it as a question or as a comment. I want to talk about Flagyl.
Mm-hmm.
Flagyl is an antibiotic, and we usually use it when we have some problem with our stomach. I used to have a friend, he would never travel without putting Flagyl in his bag. And that's because of a bad experience he had on Qatar flight. I think he took food poisoning in flight, and then he was rolling on the ground. The air hostesses, they couldn't do anything. But he knew that if they can get him his bag, they will find the Flagyl inside that bag. So they struggled to get his bag for him, and they found a remnant of Flagyl in the bag. And as soon as he used it, it was okay. Now, secondly, the same thing with me, myself. Let me use myself as an example. If I have trouble, like eating, you know, in Lagos here, we go out a lot, go to parties and things like that. So have problem with my stomach and things, or a disruption in my alimentary canal, I sometimes just pop 2 tablets of Flagyl. It's 200 grams per one. And once done, I don't go to eat again because it has resolved my problem. So this idea of completing dosage, how does it affect people like us who just want to use an antibiotic for a one-time cure? Once you are cured, you don't go back to it again. So how do you resolve that? With the idea of you must complete it and things like that. That is what I want to say. That are we safe, you know, using it for exact purpose, and then once done, then we are done with it. Thank you.
I think Dr. Yinka will be best placed on this. But from my point of view, the risk of doing that is that you're building resistant bacteria in your body. So what then happens is, at some point, if there is a significant level of bacteria and people take the antimicrobials or antibiotic, it won't work. And that's where people say it's something else that's causing it, home factor, all sorts of things, but actually it's just because of the buildup of resistant infections in the body. I am going to go to Dr. Yinka to answer more on that, because there may be reasons why that would be used in Nigeria. In the UK, we do not use Flagyl in that context. It is sometimes used when people have Clostridium difficile, which is very different, which is a different type of bacteria. So yeah, but the challenge with doing it that way is the risk of resistance. Over to you, Dr. Yinka, or anybody else that's practicing.
Thank you very much. Yeah, that's a very common thing. People, before they go to party, would even debate having problems. So people have Flagyl in their bags. They have all those medications, they have tetracycline and all of that. So that is what we are talking about, abuse of antibiotics. Flagyl has no business with you have tummy upsets, you have diarrhea. It is misuse of antibiotics. And where we're going eventually is to make sure that all these drugs cannot be purchased. The only reason people can use them is because they have access to them. If you didn't have access to them and you have any problem, then you go to your doctor, then a drug will be prescribed. So taking 1 tablet of Flagyl is abuse of antibiotics. And you find out that over the years, we have a data in my hospital now where we found out that almost 90% of resistance to metronidazole, and that's because a lot of people abuse it, and that's why we keep talking about it. Don't take antibiotics when there is no need. I remember I saw somebody once in a community pharmacy. She came and said she wanted 1 capsule of Ampiclox. I'd never had that before in my life. I said, what do you need it for? She said she used a public toilet recently and she just wanted to prevent infection. So people have all sorts of ideas in their heads. And that's why education and training is so important. We have to do this campaign. I like this idea of what India did. Everybody has to know that you are harming yourself. If you think you're actually treating yourself, you're actually causing yourself harm by taking all these medications indiscriminately. Thank you.
Thank you so much to both of you. Okay, so I hope that answers your question, sir, Mr. Lawal. Thank you for asking. Next person, Adebukola, could you unmute yourself?
Good evening, everyone.
Good evening.
Thank you so much for bringing this kind of program to our doorstep. And I want to really appreciate all the facilitators. They have really done justice to today's presentation. I just want to add to what they have said. Why the abuse of antibiotics in Nigeria is because many of us, many Nigerians, we get treatment for whatever through over-the-counter drugs. We don't have unrestricted access to drug like in the developed countries. I don't know whether you have experienced it for Nigerians. Somebody come and I'm a nurse. I will tell you, and after the doctor has prescribed anti-malaria, then the next thing is that, ma, the doctor did not write antibiotics for me. And I said, antibiotics? You don't have infection. No, that's the routine thing that I do. Once I have malaria, I must take antibiotics. The anti-malaria will not work until I take antibiotics. And I don't blame them. Many a time, we have access to it. We go to the nearby chemist and we get drug. From even many of these chemists, you hardly find pharmacists there to even cancel them. I think what we still need to do is to engage the community in the area of campaign against abuse of antibiotics. Thank you very much for this privilege.
Thank you so much. Yes, go on, Dan.
Thank you. I think that's a really good point. Thank you for sharing that. And actually, what happens is that people associate. So if they have, the malaria would have gotten better anyways. Or because actually, if it's mild malaria, you probably don't even need anti-malaria. But say you did. But because they've taken antibiotic at the same time of them, their body naturally fighting it and getting better, they associate the getting better with the antibiotic rather than their immune system can help them get, because most self-limiting infections, and for many people in Nigeria, I know there's some extremes where you do need the treatment. We do have a level of immunity to, people have a level of immunity to the parasites from mosquitoes. And so the immune system will naturally fight it. But because they've taken the antibiotic, they associate. And actually, that happens in the UK as well. Over the years, what we've had to do with general practitioners is to really encourage them to avoid obviously prescribing antibiotics so people don't associate getting better. We have another tool which we call treating yourself better without antibiotics, something along those lines. And it's for colds and flu. So we tell them you will get better within 10 days, even if you don't take antibiotics, so that people know that actually, if they take antibiotics and they get better within 10, it wasn't the antibiotic that worked, it was their body fighting it naturally. So as a healthcare professional, please continue to educate those people, because one person, if you educate them and they accept it, they will tell their family and they will educate their children, and hopefully will change, at least for that line of that generation, from continued use of abuse of antimicrobials. So it feels like a massive problem, but we can start to chip at it a little bit at a time.
Thank you. I'm going to bring it up right now. How can the healthcare professionals help to change these patients' mindset? You've heard all the things we've been saying. From what you spoke about earlier, yes, we talked about delivering excellent patient care. So yeah, just
I'm
what can you
laughing because I've been busy typing something which preempted that question and I didn't know. So what I was just about to click send on, I just had two words to add to it. I was saying, well, I'm saying here, I have a radical perspective on what we're discussing here. Of course I do, right? Okay. At the core of the abuse, the overuse, the misuse of and overdependency on medication is our physical health mindset. Absolutely. So we depend, it's as though we're looking for a magic, like a mushroom. Some people out there will say that's drugs, right? We're looking for something that we can, I don't feel good. I'm not even going to bother to find out why. Why am I feeling this way? What is there like a trend? Do I normally feel this way after I've eaten this type of food or gone to or hung out in this particular place? Or should I be careful where I eat first instead of just popping pills? So yes, it's our mindset. So if you've set your mind in such a way as, you know what, I'm going to minimize what I ingest medication wise. And that's possible. And I'm not an alternative medical professional. I'm just someone who tries to be mindful of looking after this body. See, this body has to serve me because I'm planning, my intention is to rock my way into my 90s. So I'm careful about what I ingest. So I don't take medication. I try not to. I've been suffering from bad pain, back pain, ache and everything. But the doctor will simply say, oh, it's degeneration of it's your age, because I'll be 60 in about a year. It's your age. And I'm like, well, no, this body has about 3 more decades at least to go. So no, it can't be, going out, dying on me just yet. So I try to get to the root of it. I do. Remember, Google my way into my destiny. So I go and read up on medical papers and all sorts, and I do whatever it takes to not take medication. So my GP doesn't even know me. I don't know them. Okay, because I try not to go that way. That's a lazy way. I'm sorry to say, it's like a quick fix. I just want to get on. I'm going to pop in paracetamol. I'm going to pop ibuprofen because that's what the doctor says. Just pop it every day. And, you can use however many milligrams. But all you're doing is you're masking the root cause. What you want to do is to get to the root cause. I'm not a medical professional, but guess what? I'm a professional in talk with body. Yeah. I know my own body. I'm a professional in my own body, about my body. So I don't know if that answers your question, but that's my mindset. That is my mindset. So,
but the critical thing here is that if you are not feeling well, you must always consult a healthcare professional.
yes.
Take matters into your own hands. That is the message we will always pass. Okay.
Yes. But I think because I have friends who, it's as though someone said when they go away, I have a friend who she carries a pharmacy. I kid you not, like a big box. It's like a mini pharmacy. We're going abroad on vacation for maybe 2 weeks. My friend's carrying a pharmacy with her. She's popping. It's like this one. Oh, it's so that I don't get a headache. I'm like, how do you know you're going to get a headache? Oh, because we're going to do a lot of walking. So I'm going to use this.
Yes, he's using it
preemptively.
appropriately.
Yeah. So it's not misuse, it's our mindset. So if I've taken care, I have a duty of care to myself. Remember self-care. If I have taken the care, the precautions and everything, and I do go to see the doctor. And when I go to see the doctor, I'll say, please refer me to a specialist because I know what I'm feeling in my body. And I want to I want to be educated. I want to go there, educate, and then I will go and see them. But I'm not going to go every time, they're there. I just want a quick fix so I can get on with my day. That's the point. So it's a mindset thing.
Absolutely.
Hopefully.
Yeah. Diane, you wanted to say something?
Yeah, so I think one of the key things to take away from that is prevention. And one of the key measures for tackling antimicrobial resistance is prevention. If we prevent the infections in the first instance, we will not need to take antibiotics, and then we're going to reduce the risk of resistance. There are some infections that no amount of prevention can prevent. And if you do get them, no amount of alternative routes will get rid of them because it's bacteria and they need to be tackled. So they will need to have the antimicrobials. But I think that point around preventing first, self-care, we talk a lot about self-care in this. I noticed that somebody puts behavior change into the chat, that a lot of this is about behavior change, mindset. So how do we get people to prevent the infections in the first instance? So even as healthcare workers, every time you provide the patient with the antibiotic, so that in case they need it, or antimalarial, talk to them about preventing the infection in the future. Vaccination, anti-malarial nets, cleaning out the stagnant water in your area. Those are the things that we need to also do. I'm very aware, though, that we speak from a position of privilege, where actually there's clean water, there's all of that. So we have to be mindful as well that for some people, they are just in a situation where it is absolutely challenging. And in that case, then we need to speak truth to power. So then it's the government, then it's the health system. How can those be changed?
Yes, absolutely. Thank you. One call, CT, you had your hand up earlier on. If you still want to speak, I've asked you to unmute yourself because you were waiting for a while.
Okay. Good evening. Thank you so much for the presentation. I really enjoyed it. I am a senior registrar in family medicine, and I just wanted to answer the question. She asked us, like, what is our own experience or what do we do in our little practice to ensure to prevent antimicrobial resistance. So for us in LASUT, one of the things we do is, the first thing is to try and get the diagnosis right. If you're treating a viral infection, be sure it's viral. If it's bacterial, be sure it's bacterial. So if it's fungal, be sure it's fungal. So take your the test and then let your MCS come out. Be sure what you are treating. And then counseling is another thing we do. So you talk to your patient, you get feedbacks from them, and then you also educate them. That way you're able to form like a proper doctor-patient relationship, and you ensure that the medication you are giving is for the right patients. So those are the things we do, at least in LASUT, to although it's a tertiary center, to try and ensure that we prevent antimicrobial resistance. So we try to get the culture and the sensitivity even when we want to give drugs, so that you're sure the antibiotics you're giving is going to work for the infection, the bacteria you want to treat. And then another thing we do is that we don't forget the patient on the antibiotics. So you want to be sure that the duration is right and you follow up the patient. So those are the things we do. We always follow up our patients and we establish that rapport, appropriate doctor-patient relationship. It helps us to monitor our patients and ensure that they don't overdo it with the antibiotics. So those are the little things we do in LASUT. Thank you.
Thank you. That's fantastic. Thank you so much for sharing. Joy, I've asked you to unmute.
Hello, good evening, everyone, and thank you to the speakers for today. I'm much more enlightened than I used to be. So what I had in mind has already been said by the last bunch of speakers, because I personally think it's a mindset thing. I'm a young pharmacist. I'm barely 5-year-old in the practice, and I'm still an employee. And being in the space where in the community, I'm in the community practice, also in the hospital, but majorly in the community practice. And a customer walks in or a patient walks in and they want antibiotics, and you're trying to make your own little contribution to say, do you really need this? What symptoms do you have? Why not see a doctor instead? And you don't want to dispense because you don't think it's right. But your employer could walk in and see that you don't want him to make money. You don't want him to make, you don't want to, sell. You don't. To them, it's like just sell and let's for the funds to come in first. So that if our employers who are the older pharmacists if they're not also enlightened or also educated about this, it's going to be difficult to carry everybody along, because you're going to try to do something from your own side, and it looks as if you're not making progress for them. So also to the public, there's always this common language of I know my body. I know how my body feels whenever I have such. Just give me, call it yellow and black or white pill. They have funny names for these things. And if you keep arguing with them, it looks as if you don't want to. You're trying to be difficult with the patient. So it's very challenging and very tricky. So you're trying to manage your patient. You're also trying to do the right thing. So I feel like the enlightenment or the advocacy trickles down from the head to the top. So from the bigger bodies to our employers who are the older pharmacists, to the younger pharmacists, and then finally to the public, because it has to go through all of this. If not, you'll be trying to do your own thing, and you could even be queried for not even dispensing that medication because you're arguing with the customer or the patient. That's one. Then secondly, I strongly also advocate for prevention. I'm someone who believes so much in prevention. And also, as the last speaker said, follow up. These two can help us, really tackle the burden of antimicrobial resistance. If we can prevent, we won't have to go all the way with, say prevention better than cure. But even as the speaker said about, there's some infections that you cannot really prevent, no matter how much you try to. Then let's try to follow up whenever we dispense. And I think it will help us go a long way. Thank you very much for this.
Thank you so much. That was a great contribution. Thank you, Joy.
That's
And well
really
done for that.
important. I wonder if Dr. Inka might come in on the whole the management. Yeah, we're aware of that in the sense of the business side to things. But I do wonder, I don't know what the costs are, but one of the ways to manage it, and don't sell medicines for the sake of it, but if a patient is coming because they've got what they think is an infection, but they've got symptoms, that's what they've come in for. What is it? How can you help them manage their symptoms? Sometimes it might require a non-antibiotic, so over-the-counter type medicine, but also sometimes it's about explaining to the patient and using the tools, accredited tools that has somebody's logo on it, which may make them feel like actually this person is following the guideline, if that makes sense. So maybe the counseling checklist that they have now in usage is an example of one that could be developed for when people have infections that you don't think are bacteria related, because we use that in the UK now. We show the patient with the tool and say, okay, you've got a cold or you've got what is flu-like symptoms. The evidence shows us that people get better within 10 days without antibiotics. If you don't get better and you have these symptoms, that's when you need to worry. And then you come back to us and we'll be able to manage it in a different way. So sometimes these are the ways in which you can handle it. But I totally agree with you. It's challenging if the management is not part of the whole stewardship agenda. And I shall hand over to.
Let me quickly add my own bits to that. I just want to encourage you, Joy. I know it can be very, very challenging, but I know that in that same pharmacy, if anybody comes for a prescription on something like benzodiazepines, for example, any hypnotic or sedative, nobody will sell without a prescription. And that's because now the government has enforced it as a law. If they come to your pharmacy and you don't have prescriptions for all the benzodiazepines you have, the pharmacy will be shut. And I really believe in this country that over time, we're going to get to that point where antibiotics will be restricted. The only reason somebody can come into the pharmacy to say they want an antibiotic is because of access. But I believe that over time, antibiotics will become like the benzodiazepine, like all the hypnotics and sedatives. Nobody, I don't know if no matter how much they come with all sorts of stories, I will never sell Valium or sell any of the narcotic medications to anybody without a prescription. And that's has happened over time. So with time also, I believe things are going to change. It's taking a lot of time, but over time, I think things are going to evolve into having antibiotics being restricted even in the community pharmacies.
Thank you. Thank you. Ola Jumoke, you had your hand up earlier. I can't find you now. Your video is off. To unmute yourself. All right, while you're doing that, Dr. Obafemi, please.
Thank you. I suppose there is the question of cultural understanding of illness, because most people don't understand that. And if you don't, there's an element of behavioral change. You can speak all the English you like. If this patient believes this is what is causing it or something, it doesn't matter unless you address that issue. And that is a slow process. Now, you then also have to ask yourself, how many of Nigerians can actually pick? Because if you have to go and see a doctor from some of these consultation, you have to pay the card, maybe if it's 5,000, 10,000. And the person who is ill will ask himself or herself, why don't I just use that money to go to the chemist? And not all, for now, I mean, okay, I don't know what used to happen. Most people will establish chemists without being pharmacists, or they will have someone that comes and they are not there all the time. And sometimes it's a cause and effect. I did this last week or last month, this is what happened. So you want to repeat whatever has been helpful to you. So, and I think a lot of it is, as much as it's good that we are doing this, there's a tidal wave in terms of what you are fighting against. And there has to be a concern. Everybody has to do things in the same way. And that is not really possible because of the accessibility, cultural understanding of illness. And it takes a long time to have a behavioral change. And that is the thing. So for someone who has a business like the lady, the pharmacist, who is employed by someone else, the person employing wants to make profit to be able to pay salary, to be able to take care of themselves. So there are things that are very challenging to deal with, but that is not to wash our hands off. We can do a little bit every aspect, and every little will count. Thank you.
Thank you, Dr. Bafemi. Anyone wants to make a comment on that? You're muted, Dan.
I fully agree.
Yes, yes, we definitely do agree with that. Yes. All right, Olajumoke, go ahead.
I'm so sorry, I got bumped off. I don't know what happened there. Thank you for the wonderful presentation we've had, quite insightful, and I'll probably use them. I work as an integrative counselor myself. I just wanted to reiterate the statement regarding the counseling part of it. I think it's very important because even with people back here traveling, going to Nigeria, I noticed so many people end up coming back saying, oh, I had to buy antibiotics back home and bring it to England because we don't get them accessible. It's not accessible in England. So people actually self-medicate, despite the fact that quite a number of us are quite enlightened. So I think this is a very good opportunity for everybody to appreciate the fact that regardless of where we are, we actually need to understand the harmful effect of self-medicating, despite the corners we pass here and there. I just wanted to bring up another issue quickly regarding the one-to-one with people. I noticed that some people, in terms of what they've gone through in life before, just end up using medication incessantly, not because the doctors have prescribed it, but because they just feel it's something that they need. So I think the counseling aspect comes into being for people to understand. So the pharmacists and the different healthcare workers, I believe there's a bit of help where they infuse one-to-one with the people, trying to understand where the understanding comes from, where the impression about using medication comes from. It's very important because I've had that with a lot of young people, from their friends or from their cousins or things like that. They just start using them without understanding the implications. So I think educating people and speaking to them, even if they don't come to a therapy session, at least one-to-one in the house, awareness, raising awareness in different opportunities, in schools, with children, different avenues. So even before they start to get ill, they're aware of the consequences. So that's all I wanted to bring about here. Thank you very much.
Thank you so much for that. Thank you for that contribution. Anyone want to comment on that? No? All right. Okay, before we go to the other two people who are raising their hand, please, we've popped the feedback link in the chat. We would love to have your feedback. It will take you less than 2 minutes to complete. So please do that while we're having these discussions. And let's hear your thoughts about the webinar today. Thank you. All right. And if you want the link to the recording, please don't forget to pop your email in the chat. All right. Rudy Makinde, unmute yourself, please.
Thank you very much. Yes, I'm on now.
Go ahead.
I am a community pharmacist, and I want to speak to what a younger community pharmacist spoke earlier about. You know, I own my own practice. Sometimes I've had to come in to ask for antibiotics in response to malaria treatment and different things. But I think where the balance comes in is in the fact that, just like I think it was Dr. Bafemi who said it, you know, just now, that many of the pharmacies have become, or should I say, is it that we have become, or we're more like a primary healthcare center. People cannot always afford maybe to go all the way. And also what I do as a person is when you come and then you explain what your symptoms are, I many times send them to the lab and ask them, to go to the lab and come back to me with a report. However, there are some of these tests that will take the next 3 days, maybe 72 hours for the report to be available. So following the guidelines, I think we need more, recent developments, recent studies that we really needs an antibiotic. You're sure you are prescribing what is in the best interest of that patient while you ask them to go to the lab and return back to you. So you have saved a life, and at the same time, you're ensuring that you're doing the right thing. That's one. Another thing that a young pharmacist can do is where you know that this patient does not need an antibiotic and you have explained. I do that a lot in my practice. And then I'll tell the patient, look, if I give you this drug, you are going to pay me money. But it's not, I don't want to make money at the expense of your health. And so I end up giving what I feel the patient needs more. So sometimes you could even substitute with, maybe if it's just malaria that needs to be treated and you are not giving antibiotics, you could decide to add on maybe multivitamin. And you say, when you complete your malaria drug, take this multivitamin. So when your boss sees that it's not like you're chasing the patients away and you're not making sales, an antibiotic, maybe a pack is 2,000. You end up giving a multivitamin that the person can benefit from. And then he comes back with a feedback and the patient is happy. Your boss is also happy. And I think such a young pharmacist can also engage the boss. Let me give an example of an engagement I had with a patient yesterday. This is not even antimicrobial. This patient came in to ask for a benzodiazepine, and he came with a known customer who is a healthcare provider. And I was told, oh, this person needs Lexotan. He sometimes takes it whenever he is in need of it, when he cannot sleep, and And then she was giving me every reason why I should dispense it without a prescription. And I said, look, we're doing something wrong. It's like we're helping him every time he feels he needs a benzodiazepine to be able to sleep. It's not the right approach. So I took some time to counsel this patient about how to get a better quality sleep. And I also gave the patient a book, a guide that will help him over time overcome his sleeping issues. And then instead of giving him benzodiazepine, I gave him melatonin, and I explained how melatonin will help him over time, to get back on track. And I told him what to stop doing, what to do better so that he can sleep better. And then I gave an appointment. Okay, come in about a week and let me know how you're doing. So there are ways around these things, but it would be wrong for me to just tell this patient, go away, you don't need this, you can sleep. The next thing is we'll just go to the next place and they will give. And over time, you discover that you have lost your clientele. So the issue is patient safety first, patient's health is first, but we must do our best in helping our patients get better. We refer where we need to refer, and then we use the guidelines to do the best we can in managing our patients. Those are my contributions. Thank you.
Thank you so much for that, those fantastic contributions. Diane?
Thank you so much. I think, perfectly articulated what I was trying to say, but I didn't want to get into trouble because then I wasn't sure how things fit in. Because often when patients come into the pharmacy or they're not always looking for something specific. They just know that they're ill and they want solution. And it's really helping them to see what that solution is. I'm going to put into the chat, I hope I can find it very quickly. Every time a patient takes an antibiotic, they have resistant organisms in their body for up to a year. So every time you give a patient an antibiotic when they don't need it, we are harming that patient. And I think that needs to hopefully resonate in our mind as a way. And that's another example you can give to the patient. I like what was said, that yes, I'll make money out of it, but it's not going to help you. But the other bit is actually we're going to harm you by giving it to you because now you have resistant organisms. And I really liked what Dr. Inka said earlier, that they've now found that 90%, not that I like it, but there is data that shows that 90% of the stools is resistant to metronidazole. And it goes back to what I said earlier, is that when they then have an antibiotic and they take it and they're not getting better, they think it's home factor, something else, but actually it's the fact that they've harmed themselves over time by using antimicrobials inappropriately.
Thank you. Thank you for that. Kehinde, please unmute yourself.
Good evening, everyone.
Good evening.
Thank you very much for this presentation. I would like to congratulate Dr. Olayinka Adeyemi from University College of UCH Ibadan. Precisely, I want to comment on our efforts on tackling antimicrobial resistance. Precisely, she mentioned of integration across the department, which is very, very germane in reducing this trend in our facility, especially in tertiary institutions. I don't know how you can encourage other facilities to follow what you are doing in UCH so that all other stakeholders will be carried along. You mentioned that you used to have regular meetings. This is very, very germane. Collaboration is an important aspect that will help us to control this menace in our society. Thank you very much.
Thank you so much for that. Dr. Yinka, do you want to add some comment? You are muted just now. It's come. Yeah.
Okay. Okay. Thank you very much, ma'am. One thing that I know is that the Ministry of Health, Federal Ministry of Health, presently is they are working on all the various facilities. You start this by having an antimicrobial stewardship committee. So the various institutions, most institutions right now, especially most tertiary institutions in Nigeria, have the antimicrobial stewardship committee. And by default, it should have all the various members of the healthcare team. Now, if there's any hospital that does not have the antimicrobial stewardship committee, the Ministry of Health is now they have a list of all the hospitals within the country, and they're trying to help each one of these institutions to set up the antimicrobial stewardship committee. That's the beginning, because it's from there that begin to speak to all the various units involved and talking about irrational prescribing. Thank you very much.
Thank you, Dr. Yinka. All right, I can see some people are trying to complete the form. You should have access, the feedback form. Any more questions, comments, contributions for this great topic we've been discussing tonight? Anyone else? No? Okay, can we show some love to all our speakers, please? Emojis in the chat. I know you've been sending them great feedback already, but please let us show them some love with the emojis. Thank you so much to Talkback, to Professor Diane, and to Dr. Yinka. It's been an amazing evening. I think I have quite a few CPD. It's a good thing I'm recording this. Go back and nick some for my CPD for this year, for next year. Amazing, amazing. Thank you, everybody. Again, please do complete the feedback form. And if you want the recording link, please put your email in the chat before you go. And on that note, we will say it's a wrap for this year. And we'll see you hopefully face-to-face next year in Nigeria for Heal the Wounds 2025. Good night, everybody, and thank you very much. And I'll allow everybody to unmute now. You can all say hello now. Stop.